Welcome back to Tales of Truth, where we tell the truth about veterinary medicine. I'm Dr. Angie. I'm a holistic veterinarian, and this is JoJo, veterinary nurse extraordinaire, and my co-host. Hello.
Good morning. Happy post-Thanksgiving.
Happy post-Thanksgiving. It's the Monday morning after Thanksgiving, and we're dragging a little bit.
A little bit,
Just
but
a little bit.
I was just thinking this is the most fun we get to have. So we're starting our week with some fun.
That's true. Yes, you're my favorite person to work with. We got caught up on our holiday adventures.
Right, we were supposed to start recording an hour ago,
Yes.
and here we are.
Here we are.
So
So,
so
we are
go
not
ahead.
prepared. We know we're gonna talk about arthritis today.
Canines specifically.
Arthritis in dogs, as my
Mhm.
cat meows in the background. So we're gonna talk about arthritis in dogs, which is important because it's a really prevalent, common disease that we have a lot of treatments for. In fact, we have so many treatments that it can be really overwhelming.
So overwhelming. I did do a little research because I wanna make sure I am up to date because I have a dog that is arthritic. And so I was like,
Okay.
"What? I bet there are more options out there." So I kinda have thought about this episode for the last 6 months,
Oh,
you
nice.
know? So the first thing, can I just kick us off then?
Cuz off.
Uh,
I'll just follow along.
okay,
Yeah.
follow my lead. Here we go.
Yes.
Okay, so the first thing I thought about is when I first started in practice, we diagnose dogs with arthritis by taking radiographs or x-rays, and I don't think that is the standard of care anymore. Is that
I
fair? How are we diagnosing
I
arthritis?
Well, that's such a good question. You can see arthritic changes on X-ray, but the tricky part about X-ray, just because you see arthritic changes doesn't mean that it hurts. And so
Oh,
we can see that the bones change at the joint, and we can see, maybe the vertebra and the back are kind of like growing towards each other, but it doesn't necessarily mean that's what's painful. And so I don't often use X-ray to diagnose arthritis just because I feel like it's of limited value, but it can be helpful in certain situations. So if your veterinarian wants to take an X-ray, by all means do it. But just because they see something there doesn't mean that's what's hurting your
mm,
dog. Fritz, are you coming? He just wants to talk about it. Just get on my lap. We're talking
okay.
about dogs. Join us.
Mhm.
Okay, so that's what I think about X-rays.
Okay. And so are there other ways that so mostly we're not diagnosing, we're going by symptom.
We're going by symptoms and physical exam and
Mhm.
response to treatment.
Okay, got it.
Yeah.
That clears that up because I feel like
Yes.
that used to be like, they almost wouldn't prescribe. Is this how it was when you started practicing, or were these just the
Ah,
clinics that I worked at?
I think maybe it was the clinics you were working for, 'cause
Okay,
I
I was
did
like, "Oh, yeah,
not.
we X-rayed everything
Oh, you
before
did? You're like,
prescribing."
"Oh,
Yeah,
there's arthritis," and so you would no one would prescribe an anti-inflammatory without an X-ray?
and, when I say no one, it's like maybe the first 2 practices that I worked in, which were very,
Okay.
very conventional, and it's where I did
Okay.
my internships, and sometimes I wonder if where I did internships was just low par.
I wonder how
Like,
old the veterinarians were too.
oh, at
Which
that
was
time, middle-aged.
which is this oh, okay. I'm like, that's a spicy thing to say, but
Yeah. Anyhow, okay, great. So
yeah.
people can feel comfortable if their veterinarian is prescribing without having actually done diagnostic X-rays.
Totally, because if you say, "My dog is getting up in the morning and they're really creaky and they warm out of it," that's just diagnostic of arthritis. I mean, is it 100% diagnostic? No, but, that's what osteoarthritis looks like.
Was my next question.
Yeah.
What are people seeing when they because arthritis is not necessarily osteoarthritis is not necessarily just an old man or old woman's disease.
No, but
We
more
see
commonly.
yeah, more commonly, but we do
Yeah.
see it in dogs that have degenerative joint disease or have had some types of surgery, some osteosurgeries.
Yeah, so,
Lack of
like,
a yeah.
dogs that have had cruciate tears, like
Mhm.
ACL, or we call them CCL tears, so they've had maybe a TPLO or an extracapsular repair. We know that when we get to fix those problems with surgery, that they go on to have less arthritis, but it's likely that they're going to have some arthritic changes in that knee. And so that's really common. Arthritis in the hips, really common. A lot of dogs will get arthritis in their elbows, and
Oof.
that's hard. I'd say that's the hardest type of arthritis. to have degenerative joint disease in the elbow, because then you just have bone on bone and it's much harder to treat. But I mean, any joint can have arthritis.
Okay. So then we just go into the number of treatments across the spectrum from pharmaceuticals to all the way holistic, natural leaning is expansive.
It's a
Um,
lot.
it's a lot, which is exciting because there's options and choices. And I would say that some are maybe not great candidates, but they still get like big PR, if you will.
Oh,
So
yeah. Especially a lot
yeah,
of the supplements out there.
yeah, the supplements, I would say
Mhm,
that too.
mhm.
So, I mean, when I Googled osteoarthritis in dogs supplements this morning, I was just like, wow. The
What'd you find? What
number
was
the number of different brands just trying to capitalize on that is far reaching.
is far-reaching.
Yeah.
Yeah.
So,
It's
I don't know if we should start on the more I mean, I would guess that our audience is more holistic leaning, so I wonder if we work our way from, the more natural supplements up to the pharmaceutical interventions.
yeah, yeah.
And some of them are not even supplementation. Was Some of it is just stuff that you can be doing at home to increase muscle mass or laser therapies. I mean, there are so many therapies that are not supplementation.
Right, like, I always think of arthritis treatment with supplements, pharmaceuticals, physical modalities like body work, chiropractic, PT,
Yeah.
acupuncture, and then there are some other really cool interventions that you can get with surgeons like PRP,
PRP.
platelet-rich plasma, like, all of those kind of regenerative therapies that I see less of only because I think they're so expensive.
I
So
wonder
I
if insurance will start to cover the PRP
doubt
because
it.
really, I
Yeah.
feel like it's getting some good ground or it's becoming more commonplace, I think, probably because it works.
I think that it has pretty good success, but I think it really depends on the dog and it depends on the joint. And I think you have to do it multiple times, which for some people that's really expensive.
Probably really, really expensive. Okay,
Yes.
so where do you wanna start? Do you wanna start
Let's
with
start with
physical modalities or do you wanna start with
yeah,
what do you
let's
wanna start with?
start with actually, you know what? We should start with a little prevention.
Okay.
We should
Oh,
start there.
prevention. Yeah.
Yeah, like how can you prevent arthritis in your dog? And one thing you can do is keep them at a lean body weight, which is really hard to do sometimes.
So
But keep
true.
them lean and well muscled. Especially with big dogs, you don't wanna grow them too quickly. You wanna grow them with as little inflammation as possible, and so when we think of giant breed dogs, I think that that is important, and so you wanna grow them a little bit more lean, and there's a lot of controversy about, like, calcium phosphorus balance and all that that we won't get into in this episode, but anything you can do to grow them with less inflammation and more lean, the better.
Mm.
So you don't want your puppies to be too roly-poly as they grow up. If you have big dogs. Now, if you have little dogs, it's less important. Keeping dogs well muscled is really great. Keeping them active, keeping them strong. Just same for people. That's a great way to prevent arthritis. And the other thing is if your dog does have a cruciate tear, so an ACL, CCL tear, in a knee, the sooner you can get it fixed, the better.
Oh.
And when I say fixed, like the sooner you can have surgery, the better. Now, that doesn't mean if it tears that you need to have it fixed in days or even weeks. But if you let it go for months and years, then that can lead to a higher chance of having arthritis.
Tell me more about that. Why is that?
Just because there's been more wear and tear on the joint. And so when they go in there and clean up the joint and then they change the angle of the joint. So the TPLO, what they do is they go in and clean up the joint. So they take out the ligament that's torn and causing all the inflammation, and maybe a meniscus, so the little pillows that sit in the knee need to get fixed. And so that they can do that. But then they change the way the knee works, like the angle, and so it stabilizes it, and so when it's moving in a more stable way.
That was so important to talk about. I like where you started with, weight maintenance and these things in terms of prevention. Because coming off of Thanksgiving, I just stayed with my brother who had this dog who I believe she's had a double TPLO on both, her hind end legs,
Uh-huh.
and she was really struggling the last time I saw her, and they now have her on a little weight loss program, And the mobility and happiness and joy that that dog
Mhm.
has just from the weight loss aspect of it, um, was significant. Was just a
Yes.
significant change in her demeanor
Yes.
and
And
her
it's
ability to get up and
free.
down the stairs. Yeah,
Yeah.
exactly.
Yeah.
And she actually seems happier. I mean, I'm sure it wasn't a happy process,
Right.
because feeding is fun,
Yes.
but
Food is
she is
love.
happier, and her quality of life is significantly better.
Aw, that's
Yeah,
good.
so
Yeah.
fun.
Yeah, weight loss is huge. But when your dog gets arthritis, or maybe, you have a 12-year-old lab and maybe you have kept them lean or haven't, and here you are, and your dog has arthritis. So they're having trouble getting up. Maybe they don't want to go up the stairs. They're not jumping in the car. They're not getting on the bed to sleep with you. And so here you are. What can you do naturally? And supplements I really like are fish oil. I think that's the most underrated supplement because not only does it have great anti-inflammatory properties for the joints, but it has anti-inflammatory properties for all the organs and it helps the skin barrier. It's really important and overlooked. And so I usually have people start there. Glucosamine and chondroitin, I feel a little mixed about. It's
Yeah,
never
and
my
they are the
go-to.
ones that's, like, the number 1 go-to, I feel
I
like.
know. It is. And I know 20 years ago when I got out of school, we were taught that it's a better preventative than it is treatment. And I think that's still true, but now I think we're just realizing that it's just okay. Like when
Mm.
people say, "Oh, I'm doing this, should I stop?" I never tell people to stop because could it be beneficial? Yes. It's not that it's not beneficial at all. It's just not my favorite. It's not my go-to. I don't tell people like, "Oh, you should definitely get your dog on."
Right, I know,
Yeah.
I know that we've been asked so many times why we don't carry it, because that is
Yeah.
what people are looking for. It seems to be the one that's most well known.
Yes, because we've
So,
all been kind of trained to do that. I mean, I think if you have a large breed puppy, there's nothing wrong with starting them on it early. But yeah, I don't carry it because I don't know that that's what I want people to spend their money on. Like, I don't think that's the most important one. I'd rather see you feed a better diet or keep your dog lean. I think that there are some things that are more effective. Spend your money on acupuncture. So, during glucosamine, it's okay.
well, and now I see that they're adding more and more and more things to those supplements, like MSM and, what other kind of things? The green what is it?
Green
The green lipids
muscle.
muscle, yeah.
Yeah, which is a kind of omega. So they're like, "Okay, how many things can we add to one?" Which,
Mhm.
I mean, is a good source of omega, but it's, for a larger dog, I think it's harder to get. I think it's more expensive. And so sometimes when they'll put all these supplements into one or put all these ingredients into one supplement, I don't know that they are able to get, a therapeutic dose in there.
Well, that and I wonder about the bioavailability
Yes.
when you're combining all of those things and just, here, body, take care of all of this at once. I just
Right.
wonder sometimes.
Which is an interesting, kind of underbelly. Okay, Fritz, I'm sorry, my kitty's
Your kitty is
he's like, "There are
demanding
cords
microphone
everywhere."
time.
I know. He's like, "You're finally
I'm
at
just
your
waiting for
desk."
it to become unplugged or
I
for you to
know.
go missing because the camera's gonna go off.
I
Yeah.
know. Yeah, I think in the supplement industry, I use supplements. Obviously, we sell supplements online, but you do have to be careful to not put too much value in any one that doesn't have really good studies, like you said, bioavailability. There are a lot of supplements out there, and I think most of the time, to make your dog healthy, adding more supplements is rarely the answer.
Mm.
Like I just think that it's not about the supplement game, but I do think there are some supplements that help. So I really like fish oil. The other one I really like is CBD. I think that's helpful. We know that it has anti-inflammatory properties. We know it has some studies behind it for canine osteoarthritis, and we know it's safe. We also know that it has other benefits
Right, what
besides, increasing serotonin, decreasing anxiety. And so it can be really helpful in multiple facets.
and if you are interested in CBD, we do carry CBD. That is something that we stand behind, and we've done an entire episode on CBD if you wanna know all the ways it can benefit. It's like a one-hit wonder. Well, that
What
didn't
do you
sound right because that makes it sound
Okay.
like you have to use it one time, but I mean,
Yeah.
like, if you're gonna choose one supplement.
Yes,
That
I do.
hits so many things. So one hit wonder was not probably the right language, but
You're close.
it made sense in my brain.
Yeah, no, it can do multiple things. The downside to CBD, if you have a 70-pound dog, is that it's not cheap. And so that's when I go back to, well, are we well muscled? Are we lean? And, then we do also have some pharmaceuticals that we can use as well. But I mean, back to the supplements, you're going to see, let's see what other supplements are really common. Like you'll find some like Western herbs, some anti-inflammatory herbs. And I think those can be helpful. I think most of those supplements don't have therapeutic amounts, unfortunately. I'm trying to
Well,
think
and
of what
I
else
think
you'd see
now
out there.
I'm seeing more of the egg membrane, and I think they use it from the yolk and they also use it from the shell. And so
Oh.
yeah, but I mean, I don't know if that's something that's up and coming,
Mhm.
but they're using it for muscling. I mean, I'm using it right now for muscling and my dog, like
Oh, you
to
are? Oh, the
yeah,
myos?
the myos, but there's also
Okay.
other ones. Some are the membrane of the yolk itself and some are the membrane of the shell. And I think they hit on
Oh.
different aspects, but I'm still learning about that.
Yeah. And I think you have to be careful about those things because it's not that you shouldn't try them, but,
Uh-huh.
doing things just to do them. Like I want people to see benefit.
Right.
I think I so many times people will come in and they'll bring me like a bag of supplements. And I'm just like, "Okay, are any of them helping?" And they're like, "Well, I'm not really sure." And I think I'd rather have you because that's a lot of money people are
Uh-huh.
spending on all the supplements. I wanna know that you think that they're helping or we have a really good basis to use them. I feel like in canine osteoarthritis, we have some really good markers like, "Yeah, no, this is helping." 'Cause we can see the symptoms. There are
Uh-huh.
other disease processes that we're using supplements for that maybe we're not gonna see the direct benefit. We just are assuming that there's benefit. But I think with arthritis, it's one of those diseases that you should be able to see like, "Oh, yeah, no, that really helps
Well, and there
on a
is
daily
science
basis."
behind the EFA or the fish oils and the CBD, so that I think
Yes.
that's helpful. Some of these
Yes.
other things, just be careful when you're shopping for supplements, because I'm on this journey myself, and so I've been looking at a lot of supplementation, and they'll say, "Studies show," or the studies, and if you actually look at the study, it's of 15 dogs that they studied themselves who reported back. It's not a peer-reviewed actual study, so just dig one layer deeper.
Yeah, and then and just think about, is this helpful? This is helpful. The other thing people are using are mushrooms. People are using mushrooms for all kinds of things. I think I'm not in the habit of trying mushrooms for osteoarthritis, and I probably should fix that because I think we're finding that mushrooms are so good for so many things.
Mm.
I tend to use them for other applications, and so that's one up and coming supplement. Although I hate to call it up and coming, it's been around forever.
Well, it's gaining traction.
It's gaining traction in the
I think
market.
we're understanding it better. There's more research happening in the mushroom
Yeah.
world.
Yeah, so maybe that's it. So I think that could be helpful. I love the supplements when we have, that have other benefits as well that can be helping. But yeah, so don't just buy all the supplements or
Yeah.
spend your money wisely.
Well, I had seen it this morning that creatine is coming, up and coming. If we're gonna just keep using up and coming, it's I hadn't heard of using that in the pet world, but couldn't that work?
I
That
mean,
just
it makes sense. I
uh-huh,
take creatine and I don't take it for muscle mass. I take it for brain health.
uh-huh,
And I notice a huge difference
uh,
with my brain fog and, like, if I'm tired and I haven't had enough sleep. So here's just some anecdotal evidence from Doctor Angie in my own body. But, I mean, it definitely makes sense. I think that I don't know if do we have any dosing guidelines?
Well, I
Should I
didn't get that far into it. I mean, I might. Let me see. I printed it
let
off
me
because I
look.
wanted to read it all for my own senior arthritic pup.
Let me get on Vin, make sure I don't crash our recording, but let me get on Vin and see if we have a dose that, like,
Green tea. Oh, that's a good one. Turmeric. I forget about that one a lot,
oh my gosh, yes.
and it is
But
good.
and everyone wants to use the golden paste, but no one's dogs like it. Okay, so
Yeah,
I
because
like
turmeric's kinda gross.
it's kind of gross. I don't
Yeah.
know. It's one that I see like, I'm sure it's fine, but dogs don't like it, and so therefore, I don't push past it, especially okay, what's in the golden paste that everyone makes?
I don't know,
It's
but
like a
we have a turmeric supplement.
w
I
I
don't know
don't
if
think
it's
we
any
sell it
tastier.
anymore. Do we still have it? I don't think we do. It was the curcumin.
Yeah, we still have it.
Do we? And because
Uh-huh.
we had oh my gosh, I'm just gonna this is not gonna promote any kind of sales, but I feel like that's the one that I just have to be honest, like, I feel like if the dogs eat it, great. 'Cause some
Yeah,
dogs will eat anything, right?
right.
Like, you might have, like, the lab that's like, "I'll eat whatever, like, I'll just eat my pill with nothing in it. I'm just so excited to eat something." But I feel like those kinds of flavors are not, you
I was
know,
I was gonna say, I think it has incredible benefit, but I'm not sure about the palatability.
right. Yeah.
So, when it comes to that, well, now I printed all this out and I cannot find where I found. But I see all these other things that we've talked about. Maybe I should just lay all this out. So we hit all the things.
Yeah, so I'm
Um,
looking on Vin to see if people are using creatine because the
yeah.
first thing you wanna do is make sure, like, it's safe, and I think safety studies in people like that is pretty established,
Mhm.
but we have to be careful just because it's safe in people, doesn't mean it's safe in dogs. It usually does. Cats are
Yeah.
the ones that are, like, the ones that are gonna usually throw us a curveball. Let's see, here's a nutritionist talking about it. I don't think
Well, I
creatine would
did
be
pull it. Yeah, I did pull it off of Vin.
Oh, you
Just
did?
yeah, I did.
Did they give
So,
you any dosing on
it
there?
was a veterinary partner article on Vin, but it
Okay.
just says taking creatine supplements in modest doses will improve endurance and muscle strength, but it doesn't give a dosage.
Well, that's not very helpful.
I know, this was like a really broad, all of the things you could help.
Oh, wait, is this the medications for degenerative arthritis in dogs and cats?
Yes, that's the one.
Okay, I'm looking at it right now. Oh, yeah, there's no supplements. Okay, there's no supplementing guidelines.
Oh,
So that's
mhm,
hard, right? I
mm.
don't know. Okay, well, that's something to think about.
Okay, I
Something
think
to think
we
about.
covered most of the supplementation.
Should we talk about the drugs? Let's
Right,
talk about
and drugs
drugs.
come in 2 pharmaceuticals come in 2 categories for arthritis, right? They're the ones that are actually supporting arthritis, like, in terms of helping it improve versus just pain masking. Is that fair to say? Like, there's the 2 avenues, like, one's pain control and one is more like
Yeah,
like, Librela is doing something different than Gabapentin or Tramadol or the NSAID.
right.
Like,
Yeah, they all have a little bit different mechanism of action. And so, yes, they do work differently. And so, yes, pharmacologically, they're all working a little bit differently. I think the most popular one are nonsteroidal anti-inflammatories like carprofen, also known as Rimadyl. Let's see, Daramax. What is the other popular ones?
well,
I'm just
I
so
it's
deep
so
into
funny.
carprofen.
I have a question about Rimadyl and Carprofen,
Yeah.
right? These are the same drug, correct? One is
Rimadyl is
just
the brand.
and it's significantly more expensive, and also
Sometimes.
it's one of my favorite smells in all of veterinary medicine. It smells so good, but I notice, like, Bodhi will eat the Rimadyl, but he does not like the Carprofen.
Oh, what carprofen though? So, okay, so even Rimadyl comes in flavor tabs and non-flavor tabs.
Oh, I think it's the flavored no, I don't know, but it smells so good.
Yes. There.
I think it smells so good. Other people might be like, "This is so gross, JoJo. Like, why did you tell me to put my nose in this?"
What a weird
Um,
thing. Yes, but
yeah,
why not? Let's be weird.
okay.
Yeah,
Well,
so
I don't know. So
those
I'm almost willing to pay more to just let it be so much more like, he spits it out. He finds it, the carprofen in his and I
yes.
spent a good amount of money for that.
Yeah. Yeah, so the generic, he's not having the generic.
No,
It's
he's
name brand
totally
all the way, mom.
go Bodhi. So my kind of boy.
Meloxicam is the other
I
really,
didn't know
like,
if we were still using that very often. We used it a lot in cats.
yeah, I know, and then we have something better for cats. We use Onsior in cats now,
Mhm.
but, I rarely see meloxicam anymore, but you can because it came in a liquid, so it was really good for tiny dogs, but now I rarely see it, although I don't know. I know that it comes Obic is the human version, which obviously doesn't come in formulations for small dogs, but
Yeah.
nonsteroidal anti-inflammatories are really effective. They're one of my favorite pharmaceuticals. Unfortunately, a lot of people are scared of them, which is so unfortunate because, man, they can really be life-changing for dogs. What I like about them is that if your dog handles it well, like the nonsteroidal anti-inflammatory like carprofen, you could give it every day or you can give it as needed. And I think that's really cool
Mm.
that it has like
What are
some
people afraid
flexibility.
of? What are they
I
coming in
mean,
afraid of?
okay, so the things that can happen with anti-inflammatories is it can affect the liver. I have seen this one time
Mm.
in my whole career where a dog just couldn't handle it, and they did go into liver failure for a hot minute and turned yellow. All was well. We recovered from that, and they just couldn't ever tolerate it. But every once in a while, there's a dog that just doesn't do well. It's pretty rare. I mean, it's basically the equivalent of Advil for people. Like, most people can tolerate Advil, but some dogs, it just upsets their stomach. It gives them diarrhea or vomiting or causes ulcers, just like with people. I'm sure if I took Advil every day, I'd be in a world of hurt, just because it would really affect my stomach lining. But I think that's not most people, and it's not most dogs. And so most dogs do really, really well on these anti-inflammatories.
So could someone squelch that concern by starting on carprofen and then just doing a lab test, I don't know, a month to 6 weeks in and see how they're doing?
Yeah, I think that's interesting. I have kind of an interesting take on checking for liver enzyme elevation. So, some veterinarians will insist that you check liver enzymes before starting a
Mhm.
nonsteroidal anti-inflammatory and then again 2 to 4 weeks in. Usually it's 14 days in, just to see if it's affected them. I don't always do this because some dogs are in such a place that if it did affect their liver enzymes slightly, I'm not going to take them off of it. If it's
Mhm.
beneficial, I'm going to let their liver enzymes be a little bit elevated. And so I only do it if I think it's going to change what I do. And because I see true liver failure, true liver disease associated with nonsteroidals so rarely that I think this is less important. Some people are like, I can either afford the Remedil or the blood test, but I can't do both. Like, that's a huge investment
Yeah,
saying, hey,
that's
yes. And
yeah.
so practically sometimes, and some veterinarians will just be like, hey, just sign this waiver, no, saying that this could be affecting your dog. But I still use nonsteroidal anti-inflammatories even in dogs with high liver enzymes. I mean, there's a conversation that's had about it, and I try other things, but I don't think it's a reason not to use it.
Okay. Yeah, that is a different take for
It's a different
sure.
take. Like, the new grad veterinarian is gonna be like,
Yeah,
horrified.
that comes from being comfortable in practice for so many years.
Yes.
That
Yes, because sometimes we're literally saving a dog's life with Rimadyl.
Mhm,
And so I'm not gonna be like, "Well, on paper, this isn't working out as well, so we're gonna have to stop this life-saving medication." So,
mhm,
I'm careful about doing that, really
mm.
careful. So,
And fr this is I have, like, kind of spider-webby brain today, so forgive me.
that's fine.
But why doesn't Rimadyl come in a 50 milligram?
Because it comes in a 100 and you can split it in 2.
It's just so annoying that there's 25, 75, 100, and it skips a 50, just drives my brain mad. I just want it to be in a 50. Like, why did you guys just skip that?
Because we have the 100s, and so that way the clinic only stocks 3 sizes.
Right,
Yeah, and you're like,
but
"This
my
annoys me."
type A personality needs the 50 to be in the lineup. It's
Because
just
do you think splitting the 100, it's got a nice score on it.
it
It
does have a
scores.
nice score. It's true,
Yeah.
it's easy. But it's always bothered me. Okay, so that is a life-changing medication. Do you want to talk about the injectables?
Well, first we have to talk about gabapentin.
Oh, okay, but gabapentin is working on the nerve aspect of pain, the nerve pain.
I know, but, like, every veterinarian, they hand out gabapentin like candy.
It really
We
does do bad things for hind-end weakness, and so if you have a dog that's already arthritic and slow in their hind end or loss of muscle mass, I am finding this. It's not always a great fit. There's my take.
Yeah, okay, here's my take.
Yeah.
Between JoJo and I, we've been doing this for, like, 40 years,
Oh, that's so
maybe
sad.
more,
Yeah.
like
It's
40
cheap
years.
though. Well, there's a
It's
win in the
okay.
win column.
Yes. For some dogs, it's, like, life-changing. For
Mhm.
most dogs, it's okay, and for some dogs, I think it kinda makes things worse. I always start gabapentin. So gabapentin is Neurontin in people, so it's for nerve pain, and I think sometimes there is some nerve pain when you have, like, some bone on bone or when you have, like, your vertebra, bridging to each other, so when the vertebra starts growing towards each other, there can be, like, some nerve root impingement there. So I do think a lot of dogs do have nerve pain, but I wish gabapentin was a little bit better than it is. Most dogs get over the sedating effects over time, like over a couple weeks. So it's not as good as nonsteroidals. It's okay for some dogs, and for some dogs, it's life changing. And I always start it at night to kind of get
Mm.
them used to it. So if their hind end is a little wobbly, then
They're sleeping that off.
they're sleeping it off and they're getting
Yeah.
used to it. So I think it can be useful. I do think it's overused. I miss tramadol,
Mhm. I know
which
that was the
became
go-to for a while.
yeah, tramadol. I loved tramadol. And then there were all these studies that came out that's like, it doesn't even work. And I was like, that can't be right. That's how
That
I
is
feel
true.
about gabapentin. But no, gabapentin does work. I don't want to. I don't want to say too many bad things about gabapentin. But I miss tramadol, and I still use tramadol. I just, I just need my DEA license for it, and I have to call it in. And it has like different. Most clinics don't carry it, and a lot of people were taking their dogs tramadol, which was unfortunate. So
That's we do need to do an episode on that. I
yeah,
we need to do a story time episode. But I also
story
realized that
time.
we're like 30 minutes into this episode, and we have so much to cover, and I knew it was gonna be a big, heavy one. I knew
It's
it
gonna be a big
was.
heavy one.
Yeah.
Okay, so let's move on to Librela. Let's just say it. Let's move on to
Injectables, right?
yeah. I
Okay.
mean, I guess we could talk about Adequan,
Yeah,
but
start with Adequan because too bad.
it's not that great.
Mm.
I'm
Wah, wah,
sorry.
wah.
For every once in a while, there's a dog. Like, I don't mind doing it. Some people are like, no, it really helped. And
Mhm,
so I think for that reason, it stays on the market. And if I have a dog that's already on it, that's like, it's not like I'm like, don't take it or don't do it. It's extremely safe. It's injectable. It's kind of like lubricating the joint. And so,
mhm,
I've used it for my own animals. I've definitely used it in my horses, but it's disappointing compared to everything else we have, and I find that I would say this is just my statistic that I'm making up, 90% of the times I try it, people are like, "I don't know.
mm.
I don't know if it helped." And so I feel unimpressed by it.
Okay, and it's once
Okay.
monthly, so they're having to come in once a month on
Well,
top
or
of it.
people usually learn to do it at home,
Oh,
but then there's, like, 5,000,000 dosing, like,
mhm.
schedules for it, so kinda depends, like, some people do it every week.
Oh, yeah, that's right, I forgot. It does
Yeah,
have
if
all
you
that.
look at
I haven't we haven't used it in a long time.
yeah.
So,
Anyways, so, I mean,
okay.
try it if you're desperate, meh, it's also kind of expensive, but let's talk about Librela.
I know it
Let's talk about
I am
Librela.
so interested in your take on this because it's being pushed where I'm being seen. Not being pushed, but it's
Is
being
it really?
advised.
Yeah.
Yeah, and I really don't understand how it differs in dogs versus cats with the Solensia because they're the same type of medication, correct? And you're a huge advocate for Solensia in cats.
Yeah. So
So
I love Silencian cats, and
educate me.
here's where I am with Librela. This is personal, like, because I just feel like, okay, so the FDA come out and given us a warning?
I think so, yes, I believe
Okay.
so. Yeah.
I have to say I didn't keep up on that, but there's been enough dogs that have had adverse reactions or at least adverse events associated with the Librela injection that I don't use it unless a dog is already on it. And we're recording November. No, it's December. It's December 1st of 2025. So we might get some more information about this, but I don't use it unless my patient's already on it. And if they're like, we're on it, it's helping, it's life changing, I will totally give it and feel okay about it. I don't usually start dogs on Librela because I need someone to make me feel better about it.
Yeah, well, yeah, when there was all of this happening, with all of the information coming out, I know that the manufacturer of Librela was putting out webinar after webinar after webinar of, "Let us tell you what's happening." So there was a
Yeah,
whole bunch of
okay.
PR happening.
No one invited us to a webinar.
You had to go on their site to see it. Yeah.
Oh,
But it was,
I got no
yeah,
invitation.
right?
Yeah.
Maybe it got lost in the inbox. That's where things
Oh
go
my
to die.
god. Like, so many things.
Um,
Dr. Angie's inbox, dun, dun, dun.
yeah,
Um,
anyhow, I know that there was some yeah, they I don't know what to say. Let's just say
yeah,
it wasn't
I
pretty.
yeah, I mean, because what would happen, dogs would, like, go down in the back, could not walk. And it's hard because that demographic, like large dogs that have arthritic hips that are elderly, are already going to be predisposed to these diseases. So everyone was like, is this correlation or causation? Meaning, did this bad event happen and it just happened to be around the injection time? Or did the injection cause that? And
Mhm,
I want someone to make me feel better before I recommend it. And
mhm,
I'm not an early adopter of anything. Like, I let Apoquel go for,
mhm.
like, 2 years before I wrote my first prescription, and I let Librela go, and then all this controversy came, and I'm like, I don't know.
Yeah. No, I
That's
don't feel comfortable administering it.
no,
Just
no.
no, not yet. Maybe
Somebody
they'll
make me feel
but why
better
does it
about
work
it.
differently in dogs and cats? Why are cats seeing such success with Solensia, and
Well,
why is Librela not having the same success in dogs?
I know. I think that's so interesting. I don't know. I mean, because it's not exactly the same drug, and
Mm,
cats and dogs are so different.
mhm,
And so I think that's one thing. There are people, like, if you go on to Facebook, I'm part of, because 'cause I'm always lurking. I'm a
mhm.
Facebook lurker of, like, Solensia killed my cat,
Oh, you are in those
and
groups, yeah.
oh, yeah, I like, because I wanna see what's going on.
Mhm,
Because while I trust loosely pharmaceutical companies with some of their information, there's always, like, a healthy skepticism, and, I tend to believe people.
mhm,
I try not to dismiss people's experience. Um, I have experienced none of what these people are experiencing, but once again, you have an elderly demographic of cats and, they're doing Solensia injections and something happens. Was it a lot
right,
of these cases, we actually don't have a cause, it's hard to know, maybe there was other underlying disease. Um, so it feels a little bit different with Solensia than it does with Librela. Because what I observe is that a lot of these kitties, and if you're listening to this podcast and you need me to know something different, like, I'm all ears. And so if you've experienced something, an adverse event with Solensia, I'm not telling you that it didn't happen. I'm never going to do that. And I'm not going to tell you that it wasn't related to the Solensia because I can't know that. But when I'm seeing these people post, a lot of times I'm like, oh, your cat actually had hypertrophic cardiomyopathy. And it just
right,
seemed like it was going to happen anyways. I've just seen so much good from Solensia
right.
that I feel so comfortable using it.
Well, I'm curious if the dog parents that are listening to this, if they've used Librela or if they've heard of it and just what have you heard? Like, how is it being presented to the average consumer?
Well, when I do relief, a lot of clinics are using it and
Mhm.
I see it. I mean, people are recommending it still,
Yeah,
which I mean, I might be wrong for withholding it from my patients. Like, a bunch of data might come out to show that I'm wrong, but I try to treat my patients like I would my own animal. And if I wouldn't give it to my own animal, I just can't.
right. Well, and here's the
Can't do
beauty
it.
in it, is that we have so many other options. It's not
So
the
many.
only player in the game. So
Yes.
that's what's great. Okay,
Yeah.
that was Librela.
That was Librella. And
And
then, okay, really
yeah.
quick, because I know this episode's at
Oh,
42
I know, and
minutes.
there's more I wanna talk about for sure. Like, but where were you gonna go with your
Do
really
we
quick?
make a
And then I'll
long
go with my
episode
really
or
quick.
should we split it into 2?
I don't
Um,
know. I say we finish it.
okay. We need to talk about body work,
Yeah,
chiropractic,
that's where I was gonna go too. So
acupuncture, physical therapy. So at least in really populated areas, there are all these centers popping up, which when I first got out of school, I did physical therapy. So I got certified as a canine rehabilitation therapist, and there's a lot of cool stuff available for dogs. We do a much better exam, we do gait analysis, like all the physical therapy you can get for yourself as a person is now
mhm.
available for dogs, which is
Underwater treadmills. Yeah.
underwater treadmill. We're putting life vests on dogs. They're getting in the pool.
Yeah.
We're tracking their gaits. I mean, it's
Massage
amazing.
therapy, laser therapy,
Yes.
acupuncture. I'm like, what are there's so many.
Ultrasound,
Oh, what
shockwave.
about the PEMF mats and,
Yes.
A
the
sissy
pulse
loops and
sissy loops. I mean, there's just so much cool
mm,
stuff.
yeah.
If you have the funds to do
Mhm.
it. And a lot of insurances are covering it. Shout out to Lemonade, which I have no affiliation with other than I
I
insure my
They
cats.
get the most shout outs because that's where I lurk. I lurk
Lemonade?
where people are complaining about their insurance or praising their insurance
Oh
places.
my god,
Like,
I love them
which ones
so
are getting
much.
praise? Lemonade gets praise a lot.
Yes, they
Mhm.
covered Fritz's physical therapy, which is amazing, and so, like, he got to have an assisi loop, and those things aren't inexpensive. He had a whole, evaluation by a physical therapist because I don't wanna be his veterinarian,
Yeah.
I'm his mom,
I
so
know, that's how I feel about my dogs too. I don't wanna
Yes.
do those things. Um, the
Yeah.
PEMF mask, what is that? Pulse elect what does it stand for?
So it's like pulse signal therapy, like, it's
Right.
basically
Oh,
the one thing
electromagnetic.
yeah,
That's what
you don't want to, like the one thing I would say you don't wanna do it if your dog has cancer, 'cause
'cause it's
it
increasing cell activity.
Yes, exactly, yeah,
Mhm.
so it's speeding up cellular activity. Same with laser too. You don't wanna laser cancer if you can help it.
Yeah.
But there's all these great therapies, and I have to, put a shout out to chiropractors,
Of
the good ones, only the good ones.
There are ones trained specifically in animals.
Yes. In Colorado, that's pretty regulated, which is interesting. Yeah, I really like chiropractic. I don't think it's great for all dogs, but it can be really helpful, especially for
Yeah.
dogs that aren't gonna sit still for a massage. You just get them adjusted. They can
Yeah.
walk out. Yeah.
Well, I was just thinking about at all the at-home applications too, as my dog is becoming less stable. We now have a
Mhm.
very rugged up house, so we have rugs everywhere, and it's
Yeah.
so helpful, not just for his stability, but for his mental well-being that he can trust himself to stay stand up, you know?
Yeah.
Because I notice, like, it can really impact their mental health when they don't feel safe.
Oh, absolutely.
So, rugs, he's got a special bed, maybe it's the
Aw.
stairs to get up on the bed. So all the ways that you can just I could spend thousands.
Thousands.
Yeah,
Yes.
yeah.
That's why you gotta get that Lemonade insurance.
Oh, no, too late for him. That would be so expensive. Yes.
Yeah.
Oh, well, that was a
Totally.
lot. I mean, is there more you wanna talk about in that field?
I mean, I could talk forever about arthritis, but
Yeah.
if you want to talk to me about your dog's arthritis and what's available to you and maybe what your dog would be a good candidate for, you can book a consultation with me online. You can go to boulderholisticvet.com and go to book a consultation, and you can find a spot on my calendar. I know I need to open up my December
You
times.
definitely I'm not letting you get off today without
I know
doing
you're like,
that.
we're doing this
We
right
have
now.
people that are like, "When is she opening that?"
I
So they
know.
do go sometimes, and I would imagine December consultations might go quickly.
Yes, because December is such a busy month.
Mhm.
Um, so you can book that with me. The other thing is, depending on when you're listening to this, it is likely that we will have a pre-recorded online course about arthritis because I could talk
Mm.
about this for much longer than we're doing right now. And so when that comes out, because you might be listening to this episode in 2 years from now, what is our code to get a free course?
It is Truth Tales, and you can spell Tales Tails or Tales. Either way, we'll get you the free course.
Yeah. And so you can go onto our website. And where do you go again? What's the navigation of our new
Oh, it's
website?
very long. So just go to boulderholisticvet.com, and then there is a section that says courses or learn with us.
Oh, yeah, it's Learn with Us, and then
Mm.
it, like, goes into
They're in the
courses
shop
and
as
other
well. So if you're
yeah,
shopping, which I would just recommend because also from this episode, we carry a
yeah,
CBD that Dr. Angie really trusts. We carry a
yeah.
fish oil that Dr. Angie really trusts. And we do carry turmeric that we didn't really promote very well in this episode, but we do have it.
Yeah, I kind of am a terrible salesperson, but if your dog likes it, if you have a lab, give it a try. If your dog's not too picky. Okay,
Okay.
so I think that's it. Go grab that course when it comes out. It'll probably come out sometime in 2026.
And
And
thank you for sticking with us for our longest episode yet.
longest episode yet. See you next
Okay. Bye
time.
bye.
Bye.